So if somebody has to have a full mouth of extractions, meaning you can't save their teeth, or if they're already wearing a denture, what are their options with hybrids, with dental implants?
Right. So in our office, if somebody is going to be losing their teeth, they have three options. One option would be a lower denture, and obviously there's a lot of disadvantages to having a lower denture. Generally, they don't fit good, they don't function well, and generally people are not very happy with it. It's probably the biggest problem that we could see in dentistry is somebody having a full lower denture. The next option that we would offer them is 2 implants that helps kind of retain the denture. So in those cases...
So we're talking about like on the lower, like a couple of dental implants, and you just snap it on.
Yep. So typically when we take the teeth out, same day we can place those implants, and we can usually place them in and around where the canine teeth are, and then we're able to eventually use those implants for support to help retain those dentures.
So no more adhesive, things like that.
Yeah. The nice thing is that you don't need adhesives. They fit well. But sometimes the disadvantage of that is that they can move a little bit, they can rock. So the next option is 5 implants that we would offer with a fixed prosthesis, which we call a hybrid. And
when you say prosthesis, we're talking about teeth. So they get the full arch of teeth.
Yes,
Okay.
yes, for sure. So having a full arch of teeth on 5 implants is really a great service for most people. So the 5 implants is the closest thing that we have. 5 implants with a hybrid prosthesis is the closest thing we have to people's original teeth.
And they can eat whatever they want with those?
Yes, yeah, they can eat everything. There are certain things that will tell them to kind of, be careful with nuts and really hard, chewy, sticky things. But overall, people can eat, 99% of what they
And you
used
say
to.
things like they're permanent. They really can't be permanent.
Yeah, they're permanent. They don't come out. The patient can't take them out. Us as dentists, if we had to, we could take them out. If they needed to be adjusted or they needed to be repaired, we could always take them out and we could send them to the lab and we can have them back in a day or two sometimes, just back the way that they were originally.
So on the upper, I guess the upper denture is already pretty good. Is that right? Because of the suction?
Yep. Yeah. I mean, there's a lot of people who have upper dentures who function and do well. They can look good, but there are some big disadvantages to those upper dentures. So I'd say comparing an upper denture to a lower denture, people can do better with an upper denture than they will with a lower denture in general. But the upper denture, although it can look good and it can function, a certain percentage of what they used to be able to chew with natural teeth, they are going to have their palate covered. They're going to lose taste. Food's not going to taste the same. So the disadvantage of having an upper denture would be obviously to have the palate covered. And sometimes there's a lot of loss of taste of food and the types of food that you can eat. So sometimes when those upper dentures, they do serve a purpose, but obviously having the palate uncovered and having implant support is really probably the best thing that we can offer somebody.
And and the people that do this, I mean, especially on the upper, is it like, it's so much better?
Yeah, it's great. It's night and day. I mean, like I said, people can get along with an upper denture, probably better than a lower, but having those implants and having a fixated prosthesis on the upper is really, again, the closest thing that we have to their original teeth.
Now at your office, you work as a team with your brother. I guess he's the prosthodontist, designs the beautiful smile. You do the surgical part. Tell me about your role.
Yeah, so, as you mentioned, we're all under one roof with myself and my brother, and he does the prosthetic part of it. I do the surgical part. So a lot of times, actually always, when a patient comes in, they'll always see the prosthodontist. They'll get the treatment plan, they'll see what their options are, and then a lot of those cases will need a surgical component. So those are the people who I will eventually see, and I'll be able to do that. So really, we always say there that the prosthetic plan, the treatment plan, is really the blueprint for the surgical plan that I end up.
Now it does seem very painful.
Well, I've never had one, but I've seen a lot of patients who have had implants. We've done implants on thousands of people. And I always say that, I think people come out of that always feeling better about the situation than they thought they were going to go in on. So they go in thinking, being fearful. They think they're going to have a lot of pain. They're not going to, a lot of people will hold off a lot of years because of that. And I think once they actually commit to the prosthetic and surgical plan, come in, have their procedures done, we're able to make them comfortable, and they do way better than they think they're going to do.
So during the procedure, obviously there's no pain. You do like an oral conscious sedation.
There's
They're relaxed.
There's two things that we do. We will always give somebody Novocaine. We'll always give them a numbing, so they'll always be numb. If you had a filling done or you had any other work done, you would have Novocaine. So we'll always numb them, and then we'll always, for people who have a lot of anxiety, we're going to give them the option of oral conscious sedation, which is basically 2 pills and some nitrous oxide that they can also take while they're there. And those pills and the nitrous together work really nicely to relax people. Like I said, people do way better than they think they're going to do.
How soon can they go back to work?
We have people going back to work. I've had them going back later in the afternoon. I've seen that. I've seen most of the people can get back to work the next day.
So there's really no downtime.
There's not.
If everything goes well.
There's not. I think there's this misconception of what these procedures actually are and how people are affected. I think a lot of people have had the experience of having a toothache or a really bad infection or something like that. Those are all teeth related. So we're removing these teeth. We're getting rid of that possibility. Implants in good solid bone in a healthy environment do very well, and the discomfort and the pain level that people have is really very minimal.